criticize the company or the product of your competitor. It's just not professional. And if you're doing your job, it's not necessary. Your value speaks for itself. Don't go there. Don't talk more than your prospect. For some of us, that's hard. I was born talking. That's why I love doing this stuff. But don't. Your greatest opportunity to be successful is by listening. So don't talk more than they're talking. Don't ask for medical advice. Not for you, a family member, or anybody else. Just don't go there because it happens to them all the time. It's painful. And they will duck out of a party or any other social gathering because it happens all the time. Just don't. And don't talk about your medical history, or if they say, I was treating this person with this and this and this. Oh yeah, I had that, and they don't care. Overcoming objections. Most of your objections, 99% of your objections, are the realistic ones. And don't get me wrong, this is like, yes, it's different to sell to a doctor, but there's some things that are just the same. You're not going to close every sale. You're going to get the most arbitrary arguments sometimes. I've had doctors say, the one with the blue screens. I liked it better than the one with the green screens. It's like, and I know I haven't done my job well if I get down to that kind of an arbitrary decision. But sometimes you're going to get an arbitrary decision. It's like doing this kind of speaking. You walk into a room with 100 people. Before you open your mouth, 3 of them hate your guts for no good reason except they had too much to drink last night, or you remind them of Aunt Gertie, who they hated growing up, or something else that's... So at some point in time, you're going to get an objection outside of this list, and it just comes with doing what we do. Cost, the disruption to the practice, ease of use, the interface, the learning curve, and meaningful use. So you need to have a whole host of overcoming objection arguments for each of these areas. And we've started you off with at least 3 overcoming objection arguments for each of these areas in the toolkit. Office politics. Did I skip something? No, I didn't. Office politics. I can't underestimate the importance of this because there are dynamics between and amongst all of these different categories of people working in a practice. And not every practice is going to have people in all of these categories, but they might. You're going to have physicians. You're going to have physician partners, so they're equity owners. So then the question of how do decisions get made becomes a really important piece of information for you to know. Then there are physician employees, physicians that work for the owners and maybe hope to be involved as a partner in some way, shape, or form in the future, but you never know who's going to be asked who's going to bring you in. I'm working for a pediatrician practice right now that's 2 doctors. She's an employee, and the owner is an older guy, and he basically said, you're young, you know all this stuff, you make all the decisions about the EHR for me. Well, we are going to involve him, don't get me wrong, but my main interface is with her. There are nurse practitioners, physician's assistants, I just talked a little bit about that. The MAs or medical techs. Sometimes we still see nurses. You've got office staff. You've got a practice administrator. If you've got someone who calls themselves a practice administrator, they are most likely an MGMA member. They are most likely pretty well trained. They may have some certification. Again, just like your mid-level clinicals, that's very important to them. And you will find, you'll love working with a practice that has a practice administrator. They may have a practice manager or a business manager. They may also have an office manager. A business manager may or may not have the specific skills and training that a practice administrator has. More often, more likely than not, they don't. You'll have billing and coding specialists, front desk people. You will often have family members. Be careful of this. Sometimes the doctor's spouse is the practice manager, and just because they don't have the same last name, don't assume. You will get yourself kicked out really quickly that way. And sometimes the spouse practice manager is a nightmare because they come to it with no training. They're just the wife or husband of the physician. And so in that case, you have to make them your friend, and you have to show them that you're going to help them be really successful in that role. And that's going to take some cultivation and some time. And some larger practices actually have boards, and the decision-making process may or may not involve the board. So you need to be aware of this so you can deal with it accordingly. Everything is interrelated, and be aware of that. Any big change like this, you're going to get resistance from all of the categories of employees because this is not a technology project, guys and gals. This is a change management project. And change management affects people, and people resist change. So you're going to need some skills and some chops that equip you to deal with that. But involve as many of these people at the appropriate time on the front end as you can, because that's how you engage their support and their buy-in. Talk about the blueprint tool a little bit. It is a computer-based tool. It is something that you can run on your laptop or on your system that will allow you to do some data capture. So you've got all of your prospects' information in one place where, you know, it's not a slash folder or a file folder. It's actually, you know, on your computer. Right now, this is I wouldn't even dignify by calling it an app. Let's call it a toolkit. It's in Excel right now, but it's still automated with some VBA features that make it easier to use than a regular Excel spreadsheet. So you've got your data capture. So you've got all the information that you have compiled about the practice and are continuing to compile about the practice in your electronic record. It is going to provide an analysis of your prospect needs. It's going to give you some information about the EHR functionality that's important specialty by specialty. It's going to support those revenue cycle considerations that are going to be very important to you as selling features. It'll talk about CPOE requirements. CPOE is computerized physician order entry. And that is where any order that a physician writes, whether it's a referral, a diagnostic imaging study, a lab, or a prescription, it's all captured, or consult, it's all captured in a computerized form. It's going to help you with some of the data entry options stuff we talked about earlier today. It's going to support the sales cycle, and it's going to have some of that objection handling. It has some of that objection handling for you. It's designed to be used in multiple points in the sales cycle, both as a preparatory tool as well as a data capture tool. It'll prepare you for your first contact. It'll help you with the needs assessment. It should help you, I hope it'll help you build that value proposition that you'll have at your fingertips that you can trot out there when that little door opens for however long it's open. It really allows you to sort of put together almost a prospect dossier. That's the way I think of it. And it provides some sales support to you. Here's just a little quick screenshot of sort of the first screen that provides you with some information. It goes on below here, but it's just a place where you capture all the contact information and the basic demographic data. There's some screenshot for some information specific about, it'll ask you what's the project specialty. You actually get a drop-down list. In this case, I've selected pediatrics. It goes on to say a pediatrician is concerned with physical, emotional, social health of a child from birth to young adulthood, et cetera, et cetera, et cetera. That is actually a definition that's taken from the American Association of Schools of Medicine, or medical specialties. Then there's an additional piece of information that will pop up that talks about the specific features and functionality in EHRs that pediatricians need. Again, building this data for your first sales call. Down here, here's if you've selected other, you specify, then you get a drop-down list of all of those other specialties I showed you. Here's otolaryngology. An otolaryngologist is can be a head and neck surgeon, provides comprehensive medical and surgical care for patients with diseases and disorders that affect the ear, nose, throat, respiratory, et cetera, et cetera, et cetera, and some considerations about what they need. And again, here's cardiology. You probably can't see this very well, but like other specialties, cardiologists need systems that interface easily with radiology systems and other devices. The system should also have the capability of storing video data and to calculate hemodynamic parameters and vital signs. So you'll get all of this support within the toolkit so that even if you don't remember hemodynamic parameters, you can go look that up. And so you know what it is, so you're prepared when you sit down with the cardiologist. Don't try cardiologist first. Go to a cardiologist and a neurologist and the thoracic surgeons. Put yourself on an escalator plan. Start with the primary care docs and work up to cardiologists, because sometimes they're a little bit on the gruff side. But so you know you can figure out, go up and Google hemodynamic parameters and sound well informed. Labs and other orders is a whole list of what some of the features are and then some of the benefits and so forth. Go back to what we talked about. CPOE system, patient safety, allows real-time patient information, drug dose recommendations, adverse drug reaction reviews, checks on allergies and treatment conflicts. Physicians and nurses can review orders immediately for confirmation. So you're building your value proposition. So when you sit down with them and you talk about here's the lab interface section, what does it do for you, how does it make your life easier, there's the answer to that question. There is a reporting feature in the toolkit. What it's designed to do is have these different tabs where you enter your information, and there is a final tab where you get a report that is customized to you for that prospect. This is not a physician-facing tool. This is a reseller-facing tool. But when you get it, if you choose to print it out in paper form, which is kind of how it's designed to be used, although you can use it with a notebook or a tablet, it's going to print out with some blank lines. So you take it in with your portfolio into the sales call, and you can make your notes right there. So when you get back to the office, you can enter it. If you're a touch typist and you're really good, you can enter it right there while you're talking to the doc, and you've got it all in one place. Plus, you've got all those little selling hints and objection overcome. You've got all these crib notes to help you through that engagement, because I want you to get the second visit, the third appointment, the fourth appointment. I want you to be the trusted advisor for these guys. This tool is going to be available this fall as part of the Foundation's training program. It puts everything at your fingertips. Oh, there's a whole tab that's a glossary of terms. Hemodynamic parameters is not in it, but I'll go back and add that. But all the other common terms that you're going to hear, the ICD-9, ICD-10, what is CPT, SNOMED is CPT, system of nomenclature for diseases and international diseases and so forth. And it's a key element for sales support. Let me just sort of follow up, and I'm happy to take your questions afterwards. There is another piece that I'm putting together for CompTIA that will be part of the foundations or provided in conjunction with the foundations. I didn't ask if I could talk about this, but I'm going to tell you about it anyway. This opportunity is really, really huge. It's really significant, and it's really real. So for those of you that choose to go down this path, I have to tell you, I've been working for a long time, and I've been fortunate enough to have some really great jobs and work for some really good companies. In the last 18 years, I've worked for my own company, and nothing's better than that, at least for me. In the last 18 to 24 months, I have never had more fun in my life. So if you decide this is for you, this is what you have to look forward to. You can make a real difference. I personally believe that all of this is a subset of healthcare reform, because I don't think you can legislate healthcare reform. My goal is to reform healthcare one primary care doctor at a time. That's how you change how healthcare is delivered and paid for in this country. So if you have the taste for that, you are going to have the time of your life, and quite likely you're going to make a lot of money doing it. Having said that, this is not for everybody, okay? And there's nothing wrong if it's not for you. It is very important for you to ask yourself some really candid and soul-searching questions before you make a business or financial commitment to go into reselling into the ambulatory EHR space. So one of the other things you're going to see in the fall is a questionnaire. It's a self-assessment questionnaire that is designed to help you ask those tough questions and figure out whether or not this is really for you. And there's another smaller questionnaire that goes along with that that is designed to help you figure out who to partner with, what makes a good software company and characteristic of great relationships, because we've done some of that as well. It's really up to you, and I hope that if you're interested, you will seize this opportunity. I mean, this technology is going to continue to evolve. The definition of meaningful use is current for 2011 and 2012, but that's just stage one. There is stage two that will be in place for 2013 and 2014, and stage three that will be in place for 2015 and thereafter. And these physicians are going to need support and consultation and help from you for a significant period of time to come. So this is not a one-shot deal, but it is a window that you need to get into now in order to be able to leverage that into the future. So thank you for being here today on the last day. Thank you for being so attentive and so interested, and I'm happy to answer any questions that you have now.